Primary postpartum hemorrhage is the leading cause of maternal mortality in low-resource settings and is defined as blood loss within 24 hours after vaginal delivery that exceeds 500 milliliters or poses a health risk to the woman. In Ghana, postpartum hemorrhage accounts for over 40% of all obstetric complications admitted and about 27% of all maternal deaths. So, why is primary postpartum hemorrhage such a huge killer, especially for low-resource settings? The first reason is that most low-resource health centers are understaffed. This means that with less and more overworked providers are less likely to notice when a patient's blood loss goes over 500 milliliters and subsequently initiate primary postpartum care. The second reason is that there is a huge shortage of blood in developing nations, especially Ghana. For the past 3 years, the National Blood Service of Ghana has been unable to reach its 50% target for blood supply across the country. This means that thousands of Ghanaians with various health conditions that required blood transfusions died as a result of the non-availability of blood. Among those thousands are many primary postpartum hemorrhage patients, with 26% of maternal death in Ghana being attributed to the lack of blood units available for emergency transfusions. Finally, the third and most important reason is inaccurate diagnosis of primary postpartum hemorrhage. In Ghana and many other low-resource settings, the predominant method to measure blood loss is through visual estimation. It involves a health provider viewing pools of blood around the patient and blood soaked from pads and cotton gauze in order to estimate a patient's blood loss. There is a vast body of research stating that this method is highly inaccurate and is highly variable on the doctor's training and skill level. When interviewed, numerous health providers in Korle-Bu and Komfo-Noche, two of the largest health facilities in Ghana, have expressed that they have little faith in this estimation. In fact, many express that they expect the visual estimation to be an underestimation, so they overtransfuse blood in order to err on the side of caution. Since the measurement of blood loss is a core component towards diagnosing primary postpartum hemorrhage, this is a significant issue. So, how does it all fit together? Nurses, midwives, and doctors of understaffed obstetrics and gynecology departments underdiagnose primary postpartum hemorrhage and overtransfuse blood to patients due to inaccurate visual estimation of blood. If there were a method to accurately measure blood loss during and after birth, delay of treatment to primary postpartum patients would be avoided, complications and mortalities could be prevented, and severe burdens on staff to juggle these cases would be alleviated. With 99% of maternal deaths occurring in developing nations, something as simple as measuring blood loss more accurately could greatly reduce this burden.